and get started. We'll switch on to our intro slide.
Perfect. All right, I'd like to start things off by introducing myself. I'm Gail Hawley, Program Manager for Safe Mobility for Life, and I have been working with the program since 2004 and celebrating my 25th work anniversary with the Florida Department of Transportation tomorrow. I'm joined today by Shelby Villatoro, who provides consultant support to the Coalition's outreach and advocacy focus area team. Shelby. All right. As I mentioned, today's webinar is our first Working Together webinar, which we are hosting in support of Older Driver Safety Awareness Week. The focus of this nationally recognized week is not only to promote older driver safety, but the importance of mobility independence to ensure older adults remain safe and active in their community. And this aligns perfectly with the Safe Mobility for Life's goal of helping Floridians achieve mobility independence, remaining safe, mobile, and independent, whether they are driving or not. Achieving this goal will require everyone working together, and we are so grateful that you all have joined us today to learn more about how we can do just that. Today's webinar was developed in hopes of pulling together our diverse stakeholders for interactive conversation. We are looking forward to sharing some great resources with you all today, learning what you need from us, and hopefully finding out how we can all come together to build stronger, mutually beneficial relationships that address each of our goals. Now I'm going to turn it over to Shelby, who will talk about the polling system we are using today.
Thank you, Gail, and good morning, everyone. We're so excited to have you today. Today, we are going to be using the Slido platform to ask some questions and chat with all of you, get some feedback, and really hopefully make this an engaging conversation. So there are two different ways you can use the platform. We're going to do some test runs here in just a moment, but you can use it either on your mobile phone or through the browser on your computer. So if you have your phone around, maybe go ahead and grab that if that's the option you want to use today. I do recommend that you go ahead and grab your phone and use that, as it is very mobile friendly and it's going to make it easy to be able to keep the webinar screen up and keep engaging with us while still being able to participate in the polls. But if you do prefer, you can go ahead and open up a separate browser window and participate on your computer using the URL that we have here. If you're using your cell phone, you can scan this QR code that we have up on the screen to gain access to the poll questions. And those of you that are going through the browser can type in slido.com and then enter this access number into the participant box at the top of the page to get access to our polls. If you're having any trouble with the site being blocked, maybe by your employer's internet connection, especially on your phone, you may just need to turn off your Wi-Fi to gain access to that. So give you all just a moment to get settled in there, and then we're going to test it out with our first poll question on the next slide. We're going to keep things easy here first. And so we just want to know, I know we asked this when you registered, but which of the following categories best describes you? And I know that so many of us wear so many different hats, but which one best describes you? And it's not a competition, but these will move up as more people answer them. So I'm interested to see, okay, so we've got some higher ed. Oh, healthcare. Okay. And if you are in that other category, apologies, it won't let me give an option for you to type in, but feel free to throw that into the chat. If you're in the other and don't have a place to put it, we'd love to know kind of what category you put yourself in.
That's great. Love to see from stakeholders from different areas. That makes us very happy.
Yes. I'll give you all just another minute. I'll let you keep popping in. It's a nice tester question. You can see we have about 52 total participants and only 24 so far. So I'm going to hang out here for a second and just make sure everyone's got access. And what's nice is that this option here on the left will be here for every question. So if you're having any trouble, if for some reason you accidentally close your window, your browser window, you can always have the login information available to get back into these polls throughout the presentation today.
A lot of locals.
Awesome. Yes. Okay, I'll give it just another second. We'll have one more kind of tester question to get everyone another chance to get acclimated. Okay. If anybody is having any trouble, I know we haven't gone over the housekeeping slides, but feel free to pop a note in the chat to Stephanie Hartsfield or Molly Atkins, and they can help kind of guide you through any trouble you may be having as well. Okay, so we're going to go on to our next poll question. If you haven't got in yet, that's okay. You have another chance. So we just want to know where you're joining us from. This is an open text question. So what city, even if you're in a different state, let us know what state that is. We won't know what city, maybe, unless it's a big one.
might not recognize that.
Yeah. Okay.
Ooh, Tampa.
Oh, lots of options. Wow. I think I can scroll through here.
Martin County, this is great.
This is great. So I'm actually in Orlando as well for all of the Orlando people. Gail.
Tallahassee.
Oh, you've got some out of state in Atlanta.
All right.
Very cool.
This is great. This is absolutely great.
Callie, love that. Awesome. So you guys another second to just test that out. And so those are kind of two of the main ones we'll probably be using today in terms of multiple choice and the open text to really allow you to put in information and share insights and different feedback with us. A lot of Tallahassee people, not surprised there.
Mm-hmm.
Can imagine what that word cloud of that would have been, just a big Tallahassee on the screen.
Yeah, that's why we didn't do the word cloud.
All right.
This is great. This is great to see.
Awesome, awesome. So we'll go ahead and move on, but there will be some others moving forward. So if you're still having trouble, do let us know, and we'll do our best to help get you in there. So as I mentioned, we'll be using that for the remainder of the presentation, but do feel free to use Zoom features like chat, raising your hand, and reactions to continue participating. If you're having trouble using the Slido, feel free to just jump into the chat and give us the answers there. That chat feature is located at the bottom right of your screen. If you'd like to ask a question during the webinar, you can go ahead and pop it into the chat box at any point during the webinar. We do have people that will answer it if they can, and if they want to bring it up at the end during Q&A, we'll do that as well. If you want to hold that Q&A question till the end so that you can raise your hand and unmute yourself at that time and ask it directly, please do so. We would love to hear from you and kind of put a face to the name and really have a conversation with you. And if you are having technical issues or would like to ask a question outside of the chat with the whole group, please send it directly to Stephanie Hartsfield using that drop-down option here. And with that, I'm going to let Gail kick things off with our next question.
Awesome. Thank you so much, Shelby. Now we really want to get started by asking this very important question. How do you primarily get around your community? Car. What mode you use? Driving car. Okay. Ooh, personal car. Car still wins. I do car, but also I'm really trying to walk more. So hopefully that comes up a little bit more.
I love the number of people that are putting, multiple modes. It's not one or the other. I feel like I fall in that category. It's like I'm doing my best to get a little bit of multimodal action going on. And when I can, I'll bike. When I can, I'll take the bus or the train. But, I do have to drive primarily most of the time to get around in the burbs, get where I need to go. So, but I love that it looks like a lot of you are trying to try other modes as well.
There's other modes, and I love it because that is their primary way. So that's great. All right.
Looks like we've got about 35 participating in there. We'll go ahead and jump on.
All right. So many of you said driving, or using your personal vehicle, which is one of the primary modes of transportation here in Florida. So our next question is, if you could no longer drive, would you still be able to get where you need and want to go? I'm just doing a simple yes, no here.
And I think we went back and forth on this question, right? And a big mentioned for us was everywhere. It was that word everywhere, right?
Mm.
Being able to get everywhere we wanted to go.
Exactly.
Can be a challenge.
But this is pretty cool. It is still some 44% can, which is great. So we do need to know where you live if you've answered yes. We want to know. Maybe they're the Atlanta folks or people.
Right. I'd love to see in the chat if any of you have, if it's based primarily on where you chose to live, and if you made that choice because you had options beyond driving. It'd be really insightful. Maybe we could talk about that more at the end.
Yeah. We're seeing weather is a very big constraint, which is something I know we're going to talk about a little bit later too, Shelby. So that's great. All right. So if your answer was no, that's okay. You're not alone. And the answers to those poll questions highlight why it is so important for us to talk about how we can remain safe, mobile, and independent as we age, whether we are driving or not. Most people are driving, and many don't know how they would continue to get around if driving was no longer an option. Older drivers are keeping their licenses longer and driving more miles than ever before. According to a survey released by AARP, 80% of adults aged 65 and older maintain an active driver's license, yet the ability to drive, the most frequent mode of transportation, decreases with age due to natural age-related changes that impact each of us, but at different times and in different ways. Florida is a known destination for those nearing retirement age. Currently, Florida's 65 years and older population is at 20%, and that number is expected to grow to over 25% in the year 2045. It is a common misconception that older drivers are bad drivers. Crash data shows us otherwise, but it also tells us something about older drivers that is very important, as shown in the graphic above. The red line above represents fatalities, while the blue line represents crashes. As you can see, drivers 65 years and older are involved in fewer crashes overall, but they are overrepresented in traffic fatalities. When involved in a crash, they are at a higher risk to suffer a serious injury or death as they get older. And even though they're involved in fewer crashes, it is also true that natural age-related changes can impact our ability to safely drive, along with other health conditions that may appear or worsen as we age, which is why so many people may stop driving. In an earlier poll, many of you shared that you wouldn't be able to get around if you could no longer drive. That's the reality for the more than 600,000 people aged 70 or older who stop driving and become dependent on others to meet their transportation needs each year. And that is a huge number. Research shows that non-drivers make 15% fewer trips to the doctor, 59% fewer shopping trips, and 65% fewer trips for social, family, and religious activities. Without available safe transportation options, older non-drivers are left feeling isolated with a dramatically reduced quality of life. Transportation is a unique challenge because it impacts every sector and every aspect of our lives. Everyone is impacted in some way by this occurrence. Doctors lose access to patients, businesses lose customers, the list goes on. One important thing to remember is that maintaining quality of life means not just getting where you need to go, but getting where you want to go. No one wants to think about a future where they only leave the house to get to the doctor's office or the grocery store. A person's need to stay independent and connected is a big reason why they will choose to keep driving for as long as possible, even if it may no longer be the safest or most convenient option for them. That's why the conversation around Older Driver Safety Awareness Week, mobility independence, and our work with Safe Mobility for Life is about more than just driver safety. All right, so you're not going to hurt our feelings with the answers to this question. We want to be totally honest. But before this webinar, how familiar were you with the Safe Mobility for Life Coalition and our efforts to improve the safety, access, and mobility of Florida's aging road users? Well, some very familiars. I think I know who the very familiars are. Not familiar at all, 3%. Somewhat, okay. All right, this is exciting. Shelby, I'm like very happy with this.
I know. I'm with you. I've got the very familiars, but with about, 35-ish is my stopping point. Happy with that.
This
Interested
is
to
great.
know if you have an anecdote to share where you heard about us. If you're not a coalition member, though we do appreciate you, where you heard
Yes.
about us, or if we've worked with you before, feel free to throw that note in there and jog some memories. I know a lot of people worked with Gail before, so it's always exciting to hear that perspective.
I think a lot of it is for the outreach too that we've been doing too.
Yeah.
So, and seeing some of the names. So this is great. Awesome. So when we started this program more than 20 years ago, we were an FDOT program formed or that focused on roadway improvements, which have now become the standard and benefit people of all ages. With aging population projections trending upward, FDOT wanted to take a proactive, collaborative approach to helping Floridians remain safe, mobile, and independent. So in 2009, FDOT partnered with the Pepper Institute on Aging and Public Policy at Florida State University to form the statewide Safe Mobility for Life Coalition. Our coalition is made up of 31 member organizations, all invested in the safety, access, and mobility of Florida's aging road users, which includes drivers, bicyclists, transit riders, and pedestrians. We have quite a diverse group with support from law enforcement, engineers, higher education, government, healthcare, and some of them are even joining us today. And it wasn't a requirement, so that really truly is dedication. As part of Florida Department of Transportation's Target Zero efforts, the people that represent these logos you see come together and are dedicated to keeping aging road users safe, mobile, and connected to their communities, whether they are driving or not, helping them achieve true mobility independence. The benefit of our diverse coalition members and our community partners is that we can count on them to share the expert insight when developing and creating resources and materials. In addition to their thoughts and feedback, our designs use a data-driven, research-based approach so that we can share information with older adults in a way that they can understand it. These educational materials are distributed free of charge to communities and individuals through our Safe Mobility for Life Resource Center, which is housed in the Pepper Institute. The goal of everything developed is to get everything into the hands of those who need it the most by sharing it with our partners and stakeholders just like you. So I was joking around on this, sound like Kermit, but at the end, that's okay. This means we're having a good conversation. So our coalition members have been working together for more than 10 years. And during that time, we have accomplished many milestones and helped educate aging road users and stakeholders across the state, from creating the Resource Center for statewide material distribution, to developing and launching our first workshops. Our focus has been on how we can educate others and spread the word. Our team of professionals is excited to continue our work and partner with you to share resources and raise awareness on the importance of the keys to achieve safe mobility for life. Through positive messaging, we educate older adults and stakeholders about achieving mobility independence. The coalition developed the 3 keys message to instantly let our target audiences know that we offer a layered approach to achieving safe mobility for life. It isn't just about encouraging people to stop driving. The 3 keys to achieve safe mobility for life are: understand the impact aging has on driving, and this can include discussing age-related changes that affect driving skills, how prescription and over-the-counter medications can impact driving, also Florida's ID and licensing requirements. Be proactive about safe driving skills, and you can help us provide support by encouraging and providing assessment tools to support safe driving skills, promoting and hosting workshops, sharing educational materials to encourage safe behaviors. And then last, but certainly not least, is plan for a safe transition from driving. And this could involve helping older adults build a transportation plan and explore new options. Also starting the conversation about safe transitioning from driving. We want to remind people that driving may not always be the only option, and that by being proactive and exploring new options, they can achieve mobility independence. True mobility independence means not having to rely on a car. It means having options. If we want people to be able to safely transition from driving, then we need to make sure that they have a variety of viable transportation options beyond a personal vehicle that provide safe access to the places that they need and want to go. All right, so our next question is, as much as we encourage others to work towards mobility independence, there are many reasons why people may struggle to get around beyond the driver's seat. So from your personal or professional perspective, what are some of the transportation challenges faced by older adults in your area? So we've made this just an open text because we really just are very interested in hearing from you what your thoughts are on this. Unable safe drive. These are good. Oh, the transit is unsafe. We know from our partners at Florida Public Transportation Association that that's not true. So we need to educate on that. Limited bus routes. Some good things. Lack of accessible sidewalks. That is a personal favorite of mine. Connectivity, making sure that we connect our sidewalks and our transportation systems. So that is a very good one. Weather, again, is being mentioned. And then in the chat, I'm also seeing access to modes, which is very true, especially living in rural areas. I know with our partners working with Livable Florida, maybe we can see more modes and access to those modes available in Florida communities. This is great. Wheelchair accessible transportation. That's another one. People do mobility options and being able. Lack of sufficient complete streets. These are all great. And I just want to remind everybody that we are, capturing, if we don't read them and talk about them, that we are going to be capturing them and taking them back to the coalition, because this is valuable feedback.
What I loved is the unknown, the unfamiliar. Mm-hmm. I think that, we'll talk more about that as we talk about the workshops and the resources, but just that, how easy some options like transit might be. Access is definitely a big thing, but in some of these places where access is something that is available, how simple it might be for one of them to use transit, but just not knowing how to make it an option.
You're right. And that's, I think and you'll talk about more, but why we've had success with some of our in-person workshops is that we help educate on how to use them. This is great. Electronically challenged. That's true. Like a lot of times, even using Uber or Lyft, you have to be familiar with a smartphone. And my mom, who just turned 94, just got her first smartphone. And I'm telling if we can get her to answer it. All right. Let's just go. So those were great. So what, we'd love to hear what are some of your suggested solutions to the transportation challenges faced by older adults that you service. Maybe just things that you've thought of that we might not have, maybe some best practices or things that you guys have done, or things that you think that maybe should be available too. We would love. There's always more challenges than solutions, but this is good. Affordable free rides. Okay. Making it more affordable to use those other options. Well, educate older adults. Perfect timing on that one. We're going to be doing more education, definitely. Neighbors helping. Teaching them. Oh, I love these words. Options, voting locations, affordable free rides. Again, what we're talking about, start practicing. I think this is perfect timing. And I hope that's not a coalition member or anybody that popped that one in. Because
I know. I see some, I'm like, these are key terms.
It's like we're setting ourselves up, but we're really not. We need to ask them not to participate. This is great. So these are great solutions. And we hope that today's conversation opens the door for more of these solutions and conversation about how we can address the challenges discussed. We also hope that we're able to help you explore more possible solutions with our own resources. So we have talked about there's going to be a Q&A at the end, and Shelby will have more questions too. There's will be definitely opportunities to be talking about these more. We definitely will be following up on these solutions, won't we?
Yes, absolutely. Those are great. I'll give you all just another second because I know we're usually up in the 35s. Just in case, I know it takes longer to type.
I'm trying to pay attention. I just get so anxious about everything. So
no worries. I know it takes longer to type some of these longer ones, but if we ever miss you, please feel free to pop them in the chat.
Yes.
We would love to capture them and be able to make note of them. And like Gail said, share them with the coalition and talk about, are they options we can implement or share with those stakeholders?
Definitely. I like in the chat, Steph posted businesses being car orientated as a big one. Someone mentioned that one. That's great.
Awesome. Okay.
All right. Again, these are fantastic. All right. As we previously mentioned, the Safe Mobility for Life Coalition offers a variety of educational materials and resources to help Floridians achieve true mobility independence. I'm going to pass it over to Shelby, and she's going to talk more about the different needs that these resources address and how you can access them for distribution in your communities. Shelby?
Thank you, Gail. All right, everyone. So we're going to get into resources now. Bear with me here, but it's going to be a lot of great information. I promise we'll recap with everything later. So the first resource I want to share with you today is our bread and butter, Florida's Guide to Safe Mobility for Life. I have it with me at all times. This is what we call our one-stop shop with everything needed to develop a transportation plan and learn how to put that plan into action. So our guide provides detailed information on the keys to achieve safe mobility for life that Gail touched on earlier, and it contains both statewide and local resource information for each county, such as information about area agencies on aging, community transportation coordinators, transit agencies, memory disorder clinics, and driver license and tax collectors offices, all in the back of the book. So they have it all in one place. The guide's also available in English and Spanish as a hard copy, PDF, ebook, and in the Apple app and Google Play stores. There's a variety of ways that people can access it, whether it's ordering a print copy through the Resource Center or just looking at it on their iPad or wherever they want to access. So it's a very accessible resource. We also offer a variety of resources to help people be proactive, which is what we just saw in the last slide there, right? Be proactive about maintaining safe driving skills. So staying safe while driving for as long as possible. Our roadway safety tip card series, it educates on new roadway safety improvements so that people know what to do when they see certain roadway features and signals. That includes wrong way driving, navigating roundabouts, flashing yellow arrows, and even turning right on red, whether or not they can turn in certain situations. So these tip cards and all of our materials are actually designed to include simplified instructions based on human factors research. So it's designed specifically to help provide older adults with the best education on new devices. So it makes it as easy to understand as possible. In addition to our tip cards, we also share information about CARFIT and driver safety workshops. So really just encouraging people to participate in these workshops to help stay safe and comfortable behind the wheel. Again, all about maintaining that safe driving for as long as possible in hopes that they can maintain those safe driving skills. So I mentioned that we have tip cards about wrong way driving, flashing yellow arrows, roundabouts, and turning right on red, but I'd love to hear from all of you that are out in the community. Are there other new roadway features or traffic laws that you believe older drivers struggle to navigate or understand that maybe we could use some additional education for?
The answer to this one is my personal favorite. Being in traffic engineering and operations, we're all about how can we educate.
Absolutely. So someone said signage. If you could elaborate on any specific signage, if it's just signage in general, more signage, or there's specific signage, that'd be great. So what lane to travel in, RFBs, I know good stuff there. Move over laws.
Shelby, we should share with everybody afterwards accessing, because we do have the some of the resources available. So
And we'll
can
talk
let
about
them know
those a
about
little
it.
bit. Yeah.
Mhm.
Easy recognizable signage, larger font.
Mhm.
Bike lanes, I think that's great. So more of that share the road education. Speed tables and other traffic calming features, wrong way driving. It's great.
I like too that it's not just suggestions for drivers, but pedestrians as well. It's always good.
Yeah. Right lane for speed, especially on interstates, it's a good one. So having that left passing lane.
We were just
good.
talking about that
Yeah.
in my office.
Interesting. You've got one of them in there, huh?
I didn't do it.
Yield on U-turn. That's an interesting. I haven't heard that one.
Mm.
Using a blinker.
GPS. Oh, I like bike. Someone's mentioning bike regulations.
Yeah. Good stuff. It's great information.
This is really good.
Give you guys another second because, like I said, I know these answers are a little longer. It might be hard to type on a phone. Be no judgment if there are typos, I promise. Bike box. I know those are popping up a lot. I think I saw my first one in Tallahassee when I drove up for a safe mobility meeting.
They're near the university.
Yeah, it's great information. Well, thank you all. These are all very useful. All right. Well, I love that you're talking about other modes because it goes right into my next my next slide here. So in case we haven't said it enough, it is really important for all of us to be familiar with other modes of transportation, which is something we do encourage a lot as a way to be proactive. And older adults who can utilize these multiple forms of transportation, especially before they need them or before driving isn't an option, can really remain mobile and independent beyond the driver's seat. And we want them to use these modes with confidence and safely so that we have numerous resources available to support them in doing that. Not only are many of these options great ways to get around, but they provide great social, health, financial, and environmental benefits as well, which is why we encourage people to incorporate these options into their daily routines now, and that there's no need to wait for a time when they may no longer drive. So it goes back to what some of you were just saying, that the earlier the better. Why wait? If we can walk to our local store now, let's do it. If we can bike, if we can try transit routes. So we really do use that messaging and trying to encourage people to implement new options now, practice them as much as possible, and really build that multimodal plan out whenever they can. So we have these print materials available and many others, and we're not going to dive into them all today, but we'll have some follow-ups of where you can explore those options. We also know that it isn't easy to talk about planning for a time when someone might not be able to safely drive. So we've developed our resources centered on that positive messaging that Gail mentioned earlier, so that we can support those conversations while allowing older adults to be proactive and take control of their own transportation futures and really be involved in that conversation. So our families and caregivers brochure that I have pictured here can help people start a conversation about safe driving and works well for lobbies, medical offices, and anywhere that family members and caregivers may be able to pick up information. It provides tips as well as detailed information on FLHSMB's medical review process as well. Find a Ride Florida is an online tool that's available that lists all the transportation options that are available in each of Florida's 67 counties. So it can help connect people with transportation providers in their area. And we also share information and resources in support of AARP's Age-Friendly Communities initiative. So we encourage people to identify and even advocate for communities that really meet their transportation needs. So we're currently working on Age-Friendly Florida's transportation checklist. It will be an online resource that we plan to launch next year to really get that conversation going in terms of what people need to be looking for to, like I said, meet their transportation needs and how they can advocate for those in their community. The one question we do want to ask you all is, what are some of the barriers that you see or experience, either personally or professionally, that make it difficult for you or those around you to discuss driving with older adults, safe driving with older adults, or even just building out that transportation plan? you have any unique insight. We know there's so many different diverse people on this call, and we'd love to hear any barriers that you might see or experience. Fear, get that one a lot. Fear of losing their license, not wanting to upset anyone. Independence. Yeah, I think we hear a lot that it's almost there's not really a spectrum. It goes immediately from starting the conversation to not having a license anymore, right? And it's how do we make it a conversation of planning and not just we can't drive anymore, right? And so that's kind of what we're all about, is being proactive, starting the conversation early, and really just building out a plan that is holistic and covers everything.
Shelby, I liked somebody commented on sensitivity and ageism, which
Yeah.
is so true. I mean, it is something that that is encountered, and it's nice to see that brought up.
Lack of non-driving options, so it can be difficult. One of the things in our brochure that we cover is it's really important to go into the conversation knowing what options are available for that person, right? Because if you just go to them saying that, hey, maybe driving might not be a great option, you don't have other options, that really is a hard conversation to have, right?
Yeah, learning where they want to go, like where is the places that they drive to now, and then coming up with the plan.
Yeah. Lack of alternative options. Yes.
Mm-hmm.
Oh, sorry, I didn't mean to click out of that. Give y'all another second.
That's so excited to continue.
Recognizing the need, reduce physical abilities, avoiding confrontation.
These are great.
Yes. So
I'm truly aligned with what we're doing. So I love this.
Fantastic. Okay. I will actually skip ahead now. And so one of our favorite ways to educate is by actually going out into the communities and working with older adults directly, something we've really missed these past couple of years now. So we currently offer 5 workshops that provide a unique experience for those that are in attendance. I'm going to go over each of them briefly now. But our Keys to Achieve Safe Mobility for Life workshop covers those 3 keys I feel like we've touched on about 10 times now, that go in our Florida's Guide to Safe Mobility for Life, and really lays that foundation for what it means to be safe and mobile for life. Our Safe Walking for Life workshop we developed in collaboration with Alert Today Florida, and it teaches those benefits and risk of walking as a form of transportation, and then how to mitigate those risks to increase safety. The Safe Transit for Life workshop we developed in partnership with the Florida Public Transportation Association, and it focuses on just educating and increasing the use of public transit among older adults. So it's my favorite workshops, and includes a trip on the area's local transit to a nearby destination to give that real-time riding experience. We actually teach how to buy a ticket and how to pay for the ride and go on the ride, and look at the schedule, and we usually involve the local agency in giving a presentation as well. It's a great experience. The Safe Bicycling for Life workshop was developed with the Florida Traffic and Bicycling Safety Education Program, and teaches safe cycling through in-class instruction and an on-bike skills course taught outside. I keep playing this, kind of goes with what I'm saying. And then Car Fit is a parking lot activity where a team of trained technicians will use a checklist of items to review the comfort and safety of your vehicle. So our Keys, Safe Walking, and Car Fit workshops are available as virtual workshops, so those can be done online. And you can request a workshop at the link on the screen, and we'll also be putting that in the chat, and it'll be going in any follow-ups we send out. We will be assessing our schedule for in-person workshops in early 2022. So if you're interested in any of these, you can fill out a workshop request now. We do have an option to request in person, and that we will revisit hopefully next year, and maybe that's something we can make happen with your group. So as we're gearing up, hopefully, for those in-person workshops again, we'd love to hear your thoughts. So based on your experience, do the older adults you're working with prefer in-person or virtual workshops? Are you getting any feedback from them? We've heard some words from our senior centers we've been doing workshops at, and love to hear. I've heard both ways. So, and I won't tell, but I'd love to know in the chat, do you prefer in-person or virtual?
Yeah. Oh, in person.
I think you can't beat that personal connection, though I have heard that, the virtual is nice because it, helps the having access to people that may otherwise not, be able to attend. I feel I've heard that as, especially in the height of the pandemic, people learned how to use maybe their tablets or the computers that they didn't know before. And so now they feel like they have this wealth of knowledge, which I thought was so insightful. I read a lot of articles about that. Older adults feeling like they were going back to school and getting all this great information, which I thought was fascinating. Okay.
It's nice to see all those in persons.
Yes, it is. You
We
can't
do
beat the
miss them.
connection. Yeah, but it is also nice to see, a lot of you say both. So we do hope to, as a statewide program,
Yeah.
sometimes we just can't make it some places. And if a virtual is an option that we can make work, then that'd be great to know that people are open to that.
And I think the in-person ones, they offer that opportunity for us really to hear directly from older adults themselves on maybe some issues and concerns. And we've used the feedback they've provided at the in-person to develop our resources.
Great. Oh, it looks like over half and half. Okay. And so based on the workshops I went over, I know I gave a really high level, but we'd love to see a ranking of which workshop you'd be most interested in seeing in your community with your group, or even which one you think might be most needed with the people in your area. So I'll give a transit.
I love how this can change. Yep, the transit. This is cool.
So we don't talk really much in this presentation, but with these workshops, we also work to develop train the trainers to hopefully engage with more of our community partners and being able to host these on their own and make these events that can happen more frequently and really build that community of people that are accessing these resources all year round, and that we don't have to host these as infrequent. They can really be things that might happen quarterly that are really engaging people all year long. Looks like the keys might win.
Well, I like the keys too, because it gives it's a great introduction for those others as well too. So that's a good one.
Yeah. Okay. And so one last set of resources Gail hinted at earlier that I want to highlight for you all today are our digital resources. And so in addition to our many print materials that I just scratched the surface of today, the Coalition has also developed some educational graphics and videos that complement our roadway safety tip card series and our materials, as well as PSAs that show viewers how to do things like use the guide to build a transportation plan, and also how to use Find a Ride Florida. So real quickly, I'm going to show you our quick PSA for that, how to use Find a Ride Florida, which is only 36 seconds. So it works really well for things like our presentation and social media. And so oftentimes we might use something like that to promote our Find a Ride tip card, maybe in a newsletter, in a social media post, or in a presentation like this, and then follow up with that print material that somebody can take home with them and then actually refer back to. But this kind of catches their eye, gives them something fun to watch, nice little catchy tune. And so we have those PSAs and these graphics available for people to download and use through YouTube or through our website. So after hearing some of our different approaches to education, we want to know, what do you think is the most effective way to reach older adults in your community, whether that's in-person workshops, distributing safety materials, or anything that maybe we didn't talk about, or things that you're doing with your organization. We kind of love to hear your thoughts. Is it newsletters? Is it door-to-door flyers?
Mm-hmm.
Senior centers, campaigns, send printed materials.
I like this. Lots of good suggestions.
Mm-hmm.
And we have the ways to use a lot of these, so I'm happy.
Yeah. In-person meetings,
Mm-hmm.
webinars.
In-person meetings. I'm not sure what they are anymore.
Churches, retirement homes. It's great.
They're good.
Facebook, door-to-door printed materials, printed handouts, mailings. These are all great. Literature talks. It's all great information. HOA meetings. All of it. It's all good. Just another second. Like I said, I know if you're, I think we've done a word cloud yet, but if you're having any issues with it, feel free to throw it in the chat. We'll capture it there. This is all great. And I think we try to utilize some of these in any shape, form, or fashion, but it's good to know. Community center, I think, is great. It's nice that as they start to open back up, being able to utilize that a little more.
You're very good.
Great. Okay, let's go to our next. So I know that I've thrown a lot of info at you today. Gail's thrown a lot of info at you today. So I want to give you a couple of examples of how we've worked with other stakeholders to address our common goals and objectives with that group. So earlier this year, the Coalition and the Florida Highway Safety Motor Vehicles worked together to distribute a survey to licensing counter personnel. And so thanks to the support of that partner, we were able to really get a lot of participation from the different counties to get a good idea of their unique needs. So you can see here, we got a pretty solid participation across the state. Most counties did participate. We got a lot of good feedback. And from that survey, we learned that one of the greatest needs from the licensing personnel was for more literature and more information to share. And so because of this, we were able to then launch an easy to order toolkit, which allowed offices to request print and display materials to distribute to customers and share in their lobby. So we actually launched that this week. We've already started to get a lot of orders from people wanting to get these materials in their lobbies to, like we've already talked about today, start the conversation, point them to resources to find other transportation options. And so, like I said, it's just one way that we were able to work with a stakeholder, help identify a need, and then use our resources to meet their need while also being able to meet ours. A similar example of how we work with specific stakeholder groups is the development of our health practitioner toolkit, which features materials to help healthcare practitioners start the conversation about safe driving with their patients. And so our postage paid mail-in card that I'm showing here is actually mailed out to healthcare providers and includes a link to a digital form as well that we were able to push out through advertisements. And so this allows office staff to quickly request pre-packaged toolkits that so they can quickly provide these materials to their team or place them in waiting rooms for pickup as needed. Those are just a couple of examples of ways that we were able to, like I said, adjust what we have available and really meet the needs of a couple of our stakeholder groups. And so through the Coalition's free community partner program, anyone can have access to some of our exclusive display materials, toolkits, like I just showed you, and then receive these quarterly communications with the latest updates and resources. The program's led by the program coordinator, Stephanie Hartsfield, who you may have seen in today's chat and who provides support to our partners. Steph, if you want to give a wave. Can't see you, but I'm sure she's there. Everyone is welcome to be a community partner, from agency and organization representatives to just members of the community. This is actually Harry. He's fantastic. He lives in the Valencia Lakes community and is a fantastic partner in just distributing resources and hosting workshops with us. So we, at all levels, we have support and have people join our community partner program. Some people keep it simple by ordering materials to place at a front desk at the library, while other people are looking to provide that extra level of support by tabling at an event or participating in a train-the-trainer workshop so that they can go back and host a workshop in their own community. And the great thing about the program is that your level of participation is really up to you. So we do just want to gauge interest is based on resources and your ability to distribute bulk materials. That are you interested in becoming, or would you be interested in becoming a community partner with us? And we won't be offended either way. Your answers are anonymous.
You can't be afraid to ask the questions.
And for those of you that do say yes, we will be sharing a link to the sign up later in the presentation. And we do look forward to working with you.
That is fantastic. I know Stephanie's going to be very happy too.
Another second here. I always count Harry as like our key, our key community partner. He's such a joy to work with.
But you know what? I think it's important to note that the community partners that we have are from all different areas. We do have some law enforcement, aging service providers, and citizens like Harry representing a community. But that's what we love about it. It's just kind of people engaging, like you said, however they can. So that's perfect.
Yes. All right. Thank you all. And as I mentioned, we will send a link to the forum and the page where you guys can find more information towards the end.
Right. All right. So now that we've asked you plenty of questions, so it's your turn. Do you have any questions for us? Feel free to put it in the chat. Steph, is there anything there? Or if you want to turn your mic on. Just make sure
questions that I wasn't able to answer throughout, but yeah, I was going to say, if you do have to seek authorization for this type of, sign up, it is just, the community partner agreement really just says that you're going to distribute materials fair, free, and definitely check out our website to see what that actually entails, because it's probably less involved than you think.
And also, I think a key piece is the reporting back, like letting us know where you've distributed it, because one of the things we didn't mention is how much of our program really is tied to evaluation. We really want to make sure that what we're doing, the outreach, that we're measuring it to see if we are truly making a difference in reducing the crash fatalities.
Pop the link in, which will just give you a little more run through of what it means to be a community partner, what the agreement entails. And so you can sit and take a think on it. Also, even just promoting it to other communities that you think would like to have materials or, easier access. We do hope to open up some more lines of communications, quarterly newsletters directly to just community partners so that they can get that first little bit of knowledge when there's new resources, new materials available.
I did see a question here. Megan would be happy, Megan Case, if she was here, but asking, where does one get qualified and trained to help with the CARFIT program? So we're very fortunate. We have 2 CARFIT instructors here in Florida, Megan Case, who works with us at Safe Mobility for Life, and Fran Carlin Rogers, who was just like, she's like nationally known too. She's like the CARFIT guru. And so I would just say maybe we can pop in Megan's email address.
I'm doing it right now.
Step into it. That way you can just follow up with her. She's out of the office right now, but I'm sure that that would be happy news for her to answer an email like that. So anybody who is interested in learning more about CarFit, there is Megan's contact information. Awesome. All right.
Perfect. Definitely went virtual as well, but they're hoping to, announce when they can in person again as in the future.
Yeah, and we did notice when you guys registered that you did ask, we asked you what you were interested in, and we do hope that we covered it all. I mean, there is so much to share in a short amount of time. So, if we haven't, please feel free to follow up with us. Oh, and look, Fran popped in. CarFit website's up there as well. That link is on there too. So awesome. Thank you. Well, collaboration is vital. If we are able to achieve zero deaths, we can't do it alone. We need to work from state and the local levels, and also nationally too. I do notice that we have other states, and we need all to be working together. And here are some ways that you can help. Become a community partner and distribute resources in your community to help educate Floridians about the importance of achieving mobility independence. Take a look at your organization's goals or strategic plan and think about how we can align resources and work together to make a difference. Sign up for our newsletter and listserv to stay up to date with the latest coalition information and have first access to all the new resources. And we don't ask anyone to do anything we aren't willing to try ourselves. We just would ask you to start challenging yourself to explore other options and run one errand a week without your personal vehicle. Like we do. We've really tried to do it. I think Steph was the greatest example of how she started using transit to get to work, so it is something that we can all start doing now so that we become comfortable, everybody becomes comfortable with using other options. And then last, but certainly not least, spread the word to help us keep the conversation going beyond today and beyond Older Driver Safety Awareness Week. So here are some ways that we can stay in touch. Use the link above to sign up for any of our coalition communications, access our social media channels, find our toll-free number, email us, and more. You can also reach out to me directly using the information provided here as well. We just want to thank you all for joining us today. We look forward to working together to help Floridians remain safe, mobile, and independent for life. Thank you so much for your time.